Can you think of one individual or family, some story that stands out that you think it just epitomizes the work being done?
Well, one of the things, again, that I see again and again in our office is a bulletin board with picture on picture on picture of a healthy mother and a healthy baby. And that tells me that just with a little bit of intervention, you make the difference not only in the life of the child, but the life of the mother and the life of the family. It is a ripple in a pond. But the other thing that we're seeing is that we have raised our age group to 23. And the reason we've done that is because we have provided good primary care and preventive care of these young women and young men. They're going to college. They're living the American dream. They are making it. And so I have found just personally, looking at these young women and looking at these young men, we're so proud of them. And it wouldn't have been possible without that primary prevention that the Charities has provided us. You know, as I look at as I look at Texas TSU and I look at University of Houston, we have tons and tons of patients who have graduated. It makes me excited, and we are thankful for the charities to play a role in that, because that has made the difference in the whole family's life.
Could you do a little bit about how most of the population is vulnerable and, you know, underserved?
Okay. You know, the individuals ask me, how do we define our population? Are they really poor? And I have a variety of ways of saying that. Number one, economically, yes. They live in the inner city. In many cases, they're from single-parent families. They have no resources. They're usually at 100% of poverty. About 89% of our patients are at 100% of poverty. And I explain to people that we do assess. We do assess payment. By federal guidelines, we are at a little or no cost, but I can also report that of the 26,000 visits we had last year, we got $689. So poverty is the name and the face, but the positive side is that I see these kids winners. They may not have had the luxury of choosing a family that is well off, but they have the support of their family, and they have support of our clinics, that they are somebody, they can make a difference, they've not gotten in trouble. And what I tell people is, if you were 14, you really thought you need medical care, and you took 3 buses to get to a clinic, wouldn't you consider that person a winner? And we do. So they are poor, but that doesn't mean that they don't have hope for the future. And that's what we try to do, not only for our young women, but for our young men. We also know that this population has no health insurance. And so, again, starting early means that they have an opportunity to avoid a lot of risk, not only health, but behavioral risk. And we're here to stand by them, you know, put our hand on their shoulder psychologically, whether it's encourage them to stay in school, encourage them to make better sexual decisions, explain to them the risks associated with the diseases out there, or help them get a job. And so that's our role. It's more than medicine, but life is more than healthcare.